Welcome to AIM in Practice, where we explore the world of integrative and complementary medicine and how it's being applied in real-world clinical practice. I'm your host, Dr. Jess Reynolds. In each episode, we engage in really fascinating conversations with leading practitioners, innovators, authors, the people who are shaping the future of holistic healthcare. Now, today's episode is the first of what will likely be many very fascinating conversations with Dr. Nikita Vizniak. Now, Dr. Nick is an expert in manual therapies, a chiropractor since 2001, a highly sought-after and well-respected educator, and of course, an author known for his evidence-based, patient-centered approach. And I am super grateful to call him friend and mentor as well. Now, in this episode, you will learn the difference between traditional and modern chiropractic care, how empowering patients can prevent dependency on frequent treatments, the role of the nervous system and the role it plays in manual therapies and overall health, how to apply the minimal effective dose principle to maximize patient outcomes. So let's dive into our conversation with Dr. Nick. This episode is brought to you by AIM Online Education, and we've got a free gift for you. That's right, 100% free, no strings attached, and that's our free course on burnout prevention and self-care. Because, as a practitioner of any sort, we pour our energy into helping others feel better, and it's rewarding work. But let's be honest, it can also be pretty draining. Those long hours, the physical demands, and of course the mental and emotional labor of caring for others, it tends to add up. And here's the thing, our industry tends to celebrate the hustle. Book more clients, they say. Expand your services, they say. Market yourself 24/7. And this is all fine and dandy, but it's really easy to fall into the trap of thinking that working harder and longer is really the only way to succeed, which I can tell you, it's not. And what cost does it come at? That nagging tension in your shoulders, your elbows, your neck, your wrists, the struggle to fall asleep at night, feeling irritable with your favorite clients. These aren't just part of the job, they're the warning signs. Signs that, if ignored, can really lead to full-on burnout, which is a really terrible place to be. That's why I've created this free course. It's not about working harder, it's about, of course, working smarter and taking care of yourself in the way we take care of others. We'll explore practical strategies for preventing burnout, from simple daily practices to long-term career stability. Whether you're just starting out or you've been in the industry for years, this course has something for you. So click the link in the show notes and access burnout prevention and self-care for free. Well, Dr. Nick, thank you so much for joining me. I'll start by a little introduction of how we met each other. We were at a conference not too terribly long ago, the Canadian Massage Conference. And this memory of meeting you sticks so firmly in my mind. So there I am. I'm standing in a corner, a nice shadowy dark corner as somebody else is presenting. Dr. Nick comes up and he says, "Hey, what do you think of this?" And I'm like, "It's pretty good." And then you said, "So tell me, what do you think of universal basic income?" And immediately I'm like, I like this guy. I like this guy a lot. Like, we're jumping right into it. And then immediately, like you said, it was like stepbrothers. It's like, yeah, are we best friends now? So
Yeah, exactly. What I liked about it was like, oh, what about this? What about this? And it was just idea after idea, and we're talking about how we thought about it. And then you took me rock climbing, which I haven't done in about 5 or 10 years. So it was fantastic to get back into that game a little bit. So super cool. Yeah.
So it was an awesome experience. And I'm really grateful that since then we've connected quite a few times. And I'm looking forward to this chat.
Nice. Me too. It's going to be excellent.
All right. So I want to talk to you about the Chiro Playbook. And what I mean by the Chiro Playbook is, in the world of manual practitioners, wellness practitioners, Chiros are they're awesome at getting clients in the door, getting them to rebook, getting them to stick to the treatment plan, whatever that might be. And in other modalities, that doesn't really happen. So let's talk about that.
Well, I've been Chiro since 2001, I should say, 2021, 2001. And yeah, you're right. Or actually, what I would suggest is there is an old playbook version and a newer playbook version that we're looking at right here. The old school playbook, as I'm sure many of your viewers and listeners are aware of, is I need to see you 3 times a week for the next 6 weeks, and then 2 times a week, and then taper off after that, right? And of course, there can be a bunch of different things that are said that are of questionable scientific evidence, including subluxation-based theories and all of this. But if someone has an income that is dependent on the number of people I see and how often I see them, guess what tends to happen? You tend to see them a little bit more often. If I spent $50,000 on an x-ray machine, guess what tends to happen? You tend to get x-rays a little bit more in that practice, right? So that's a major part of the playbook. And just to be clear on this, when you go to chiro school now, you are looking at $150,000, $200,000 of cost over that 4 years if you include just the tuition fees and living expenses. If you add the lost potential of income over those 4 years, you're looking more at like $300,000, $400,000 of potential loss right there, or cost overall.
Okay. So I think, well, one, that's a super important consideration that I don't want to necessarily go on that tangent, but I'm super grateful that you brought it up, is when we talk about education cost, we're not only talking about the pure cost of education, we're also talking about the cost of lost earned income. So very important. Now, when you go through the education of chiro, how much time is actually dedicated teaching practitioners how to do the whole care plan compliance thing, get people to come in and rebook?
Yep. So like most programs, so basically, again, just to review what chiro education is, you should have at least 3 years of post-secondary, probably a bachelor's degree, and then you have another 4 academic years of post-secondary. And you would start to go through that playbook of how often a patient should be booking in your second or third year, whenever you get into the student clinic. And it's almost like chiropractic lore that it's done like that, 2 times a week or 3 times a week for the first 4 to 6 weeks, and then you gradually taper off during a few episodes. So I would say it starts in second year or third year. You would experience even as a first year student when you're going into the student clinics and seeing what it's all about.
Okay. Okay. And are there any like specific, like, here's a script that you end up having to use, or here's a script you should use in order to do it?
I wouldn't say there's specific scripts, but there are definitely going to be institutions, especially that are more biased towards subluxation-based theories versus more contemporary evidence-based theories. For a number of schools, they use the green books written by D.D. and B.J. Palmer that basically say nerve interference is the worst thing in your body, and we are going to exorcise the demons, okay, by getting rid of that nerve interference. More recent evidence would suggest this may not be the case.
Can you dig into that a little bit more? Like, what's the difference between the two?
Yeah, all right. So you're basically looking at the difference between diversified, evidence-informed chiropractic practice versus a more, what do I want to say, energetic chiropractic practice. So if you're looking at they're basically taught at some schools, and those schools are having some difficulty right now, a energy-based model of nerve interference and subluxation theory that causes impingement of nerves or misalignment of vertebrae can cause impingement and irritation of nerve that results in symptoms distal to where that nerve goes. Most people have seen the image of the spine of the back that shows all the nerves running out to different spinal levels. And what happens in some chiro schools is they'll take that to an extreme level and say that if you have problems at T4, T5 spinal level, it can lead to angina type symptoms. If you have problems at L4, L5, it can lead to digestive symptoms. Or there's like Weber technique and other things like that that are out there that are, we can change the position of your baby by the adjustments that we do on your back to help the birthing process go better. Current evidence does not support most of those claims.
That's super interesting, because I'm like eyeballs deep in the whole manual therapy and wellness world. And as far as I have known up until this conversation, that's still like the common ethos, like what everybody understands. I shouldn't say everybody, what a lot of people understand chiropractic to being about. So what's the new school of thought then?
Well, old school would be bone out of place, we're going to put it back in place. There's detailed studies. We actually talk about it in our book, Chiropractic Technique, and in our chiropractic, clinical chiropractic book. That's like, this one's like 600, that one's like 1,200 pages, over 5,000 references. Is you look at more detailed recent MRI studies, and bones don't go out of place. Even if you look at adjustments that were done, so high velocity treatments that were done to mobilize joints, the joints wind up going back into the position that they were in almost instantly or within 20 minutes. Even the gas bubble that forms from the cavitation that you hear is reabsorbed in about 20 minutes. So really what we're looking at is more neurophysiologic effects that might be taking place. But really what we're looking at is more, the newer stories are going to be along newer theories, I should say, are going to be along a holistic approach of balanced medicine, where it's not just going to be a chiropractic adjustment, but it's also going to be home care activities, nutritional modifications, all this stuff to create a more balanced and equal lifestyle for the person to give you better long-term results. I mean, if you want to look at it, what's the ideal patient is one that is dependent on your therapy. Oh, you got to come in once a week or twice a week or once a month. It's actually illegal in the province where I practice right now for you to do that. You can't have people sign up in advance for multiple treatments like that and pay in advance. They can decide when they want to come in, but at the end of the day, if you get somebody on a cycle that is, you're paying for 10 visits up front, come and use them whenever you want, you're not allowed. Yeah. And
Mm-hmm.
even Weber technique is not recognized as a specific technique or evidence-based content, all this stuff, right?
Interesting. When we're talking about like the average person, even other practitioners, massage therapists, acus, whatever they are, osteopaths for crying out loud, are thinking to themselves, when somebody goes to a chiropractor, what's happening is joints that are subluxed are out of places. And put a pin in this. I want to talk about ribs out of place in a moment. But, there's this general idea that that's what's happening. So if current evidence and science is showing that that's not actually the case, can we dig a little bit deeper into the effect? Somebody comes in, you do a chiropractic adjustment. What's actually happening there?
Okay, well, there's a number of great physiologic effects that happen right there. And one of the main theories currently is around a decrease in central sensitization. So what happens, you have an injury to your low back, we'll say, because that's the most common thing, or neck pain, whatever it is. And the actual injury itself, these things heal at a cellular level relatively quickly. But what winds up happening is a residual pain perception and loss of range of motion and hypervigilance and fear of movement that people get with catastrophization and central sensitization potentially, where that cycle can be broken by a adjustment. So hearing a cavitation or crack in their back can cause a reflex muscle relaxation, stimulation of nerves. If you go onto YouTube and you type in Vizniak joints of the body, I actually show on an MRI and an ultrasound what actually happens. You can see the joint actually stretch out and then pop and all the ligaments stretch out. But what we tend to see with that as well is a reflex of muscle relaxation as well. As long as the adjustment wasn't painful or super uncomfortable for the person, they'll usually relax better after it. And as soon as they get up, they'll feel like they can move a lot better. Even for myself, I do get regular spinal joint mobilizations done, and it's the same thing. If you're talking about ribs earlier, we'll come back to that. If I can feel where I have a rib that isn't moving quite right, and I'll move around and I get it adjusted, then you can get up and you can take that deeper breath. You feel like you can move around. If you have the neck tightness, you feel like you can twist your neck from side to side a little better following it. The key thing here, though, is if you're doing evidence-based best practices, is not to create dependence, but build resilience and empowerment in your patient to give them home care options and ideas where they could run for a little bit longer before they need this kind of treatment again.
Okay. So many different directions I want to go with that, compliance in home care. Yeah, I think that's... No, I'm going to go this direction first because I want to make sure I'm understanding you properly. What I believe I'm hearing is you describing the fact that the process of chiropractic therapy, it's sounding like ultimately has to do with nervous system re-regulation or re-education.
Yeah, sure. Or change in sensitivity in areas. Sure. Or you could even take a more fundamental look at it too. Even the range of motion that you get somebody through can reinitiate electrochemical signals in the local area and through upper and lower motor neuron pathways and sensitization pathways as well to change the person's perceived pain or discomfort and allow them to explore new ranges and realize they might not be damaged as much as they think they are, or that they can move in ways they didn't think they could move.
At risk of oversimplifying something, which is vastly complicated, what I appreciate now more than ever, particularly after this little chit chat, is the nervous system is it's like a master system, right? Like I always say to massage therapists, you work on the muscles, you work with the nervous system. With acupuncturists, we're not actually putting needles and affecting the nervous system directly. We're affecting the fascial and the endocrine system, ultimately through the nervous system. It seems like so much of we do is affecting the nervous system, but through other systems, meaning everything is intrinsically connected to everything.
Yep, I think that's a bang-on statement to make. There's even neurohormonal interfaces that are occurring in places like your adrenal glands and all that. I think if you were to look at the way that really most of our therapies work, number one, people have a hard time with this, but there's going to be a major placebo effect. Just the belief in future wellness is going to give you 15 to 30% of your effect right there. Part of my process is people always ask me, when does a patient visit start? And people are like, well, when they come into the clinic, I always say, no, the patient visit actually starts when they first start to think about booking in with you and what they're trying to accomplish with their long-term and short-term goals. Usually it's pain reduction, but there can be multiple different options that they're looking for with this. But if you look at one of our major graphics that I keep back here, the best practices for musculoskeletal pain, this is all evidence-based content based on systematic reviews of thousands of patients. And we know what actually works for people. And our manual therapies, this is that graphic right there where I'm pointing, is just a minor portion of everything else that we should be putting together for that person for optimal outcomes. If I go to the old school playbook for chiropractic, what do I see? Well, we measured your back and you can see that you've got subluxations, you've got a tilt here, and they're going to make claims that they can change these tilts or modify all of these processes, and that I need to see you 3 times a week. Can I talk about this case a little bit in particular? This is one I keep in my
Yes,
file.
please.
All right, this really makes me mad about this. So this was a case of a 12-year-old girl who is perfectly healthy. So I'm going to give you the case that I was given. They had gone to see another chiropractor, and they wanted to get a second opinion. So first of all, this family was driving, the grandma was driving the child 1 hour to the chiropractor and then back. And guess what the treatment frequency was? 3 times a week for the next 6 weeks. I need to see your kid. I'm like, great. I said, okay, because I don't want to presume any judgment or create any negative content around anything for any patient or any other practitioner. They went ahead and did this. They went for 2-3 visits, and then they decided to come in and see me, and they wanted a second opinion. So we went through and I evaluated her. Her primary concern was we wanted to see that her back strength was strong enough for her golf swing, of all things, okay? So I go ahead and do my assessments. I say, all right, this is a 12-year-old girl, and I'm like, okay, let's go ahead and see how many push-ups you can do right off the bat. Range of motion was all fine, we'd all done that. She bangs off 20 push-ups, no problem. I'm like, okay, can you do some sit-ups for me? Yeah, she just does them, and she could keep going as long as she wanted. Nope, we don't see anything else. Do some squats for me. Lower body check is fine. I'm like, okay, can you come and do some pull-ups on our pull-up rack? She does pull-ups, and I'm talking perfect form pull-ups and stretching all the way through like this and chest almost touching, and she bangs off 10 of those at 12 years old. Now you tell me what 12-year-old girl can do that. And I'm like, so you're going 3 times a week for this treatment right now. Are you noticing any benefit? No. And I'm like, what is this treatment costing you? And they're like, well, by the time we're done, it's going to be over $2,000. And I said to them, I look at this kid and I look at this family who's in here with me. I'm like, your daughter is perfectly healthy. If you want to see her golf swing be better, she should be practicing her golf swing more and exercises specific for that. There's no magical adjustments or bone resetting that you're going to do. And even this stuff we know, especially if they try and sell it to you with x-rays, we know that if I took an x-ray with you standing like this, and then I took an x-ray with you standing like that, guess what? The alignment and the numbers look different. This is a big time sales pitch to get as many people in for as many visits as possible. And in my opinion, it is not in the best, it pisses me off, that's why I'm starting a little on this. It's not in the best interest of the patient, the family, or any profession that's involved with that to actually continue this mindless, let's see you 3 times a week, and that it's not serving anybody. In fact, you could even make an argument that it might even be harmful. Never mind the financial harm, just the actual time involved. Sorry, I went on a little tangent there, Dr. Jess.
An important tangent.
That's near and dear to my heart, and it pisses me off to no end.
And to me, it seems, and I don't want to necessarily pile on the negativity, but I believe it's a super important thing to consider that model on superficial level seems sustainable, right? Like you said at the beginning, the way to make more money is to see people more often. But the reality is, the sooner you fix somebody, the sooner they become a lifelong advocate for you in your entire practice, right? So you get more referrals, you get them booking when they just want a tune-up, right? Like that's the way to build a sustainable business, not to come up with some arbitrary treatment plan that is going to require 12 to 50, blah, 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 right?
Yeah, but you're 100% right. But the thing is that simple models work good for the patient populations. Okay, if I'm John Q. Public or Jane Q. Public, what's happening out there? Oh, I have a bone out of place, you're putting it in, that's that little clip that I hear, or let me even do this. This is the big one right here. Yes. So you see how this is like this, and let me put it the right way. There's a little bulge right here. Well, guess what? My adjustments are going to get rid of that bulge. No, they're not. Look at your evidence, look at your research, okay? You're going to see bigger bulges actually reabsorb spontaneously better than small ones, and you would see that just basic range of motion, and me helping you facilitate that range of motion is what's going to help. And I'm there as I do this at all the seminars that I speak at as well. What are we really all in healthcare? You're making sure that there's no emergencies, but I'm getting my pom-poms out and I'm going to say, yes, you can, and get my arms up for that, to give you permission to move when it's safe and recognize red flag warning signs. That's going to be more empowering for you as a patient rather than what I'm going to call the fear mongering of, oh yes, if you come in and see me because you've got this pelvic malalignment from whatever reading that was done right there that we may or may not even be able to change, I'm probably, again, my practice style is going to be working more towards your evidence-based best practices and ultimate results because I care what the real return is on this versus seeing you again and again in my office as a business.
Right. And it's kind of tricky because it's on one hand a harder sell. It's strange, right? Like the easy sell is I'm going to fix your problem. All you have to do is show up for the next 12 weeks versus you're going to fix your problem. All you have to do is go through that wheel that you have in the background of is it that's what 10 different things to I can't count them. We'll call it
Yeah, eight things we got to go over
eight
there. Yeah.
things, same as
Yeah.
my eight elements of health, right? So you're going to do your own work. All you have to do is commit an hour to 2 hours a day, and you don't have to see. It's way harder to sell people on the fact that they have sovereignty over their own health.
Well, no. So, but the thing that I'll do is I'll leave it up to the patient to decide what they want to do. And a lot of people respect this process better. So I can remember one computer programmer I had from Intel when I was practicing in Portland. And the guy would literally drink 2 liters of Coke every single day. That's what he did. That's how he got his energy and did his programming. And he would sit at his desk like this, hunched over the entire time, and all this kind of stuff. And he'd have chronic middle back pain right here. And I gave him the choice. I'm like, look, you can go to some kind of yoga flow movement, a little bit of lifting and stretching is going to make a big difference, or you can come in and see me every week. And that would be a rare example where someone chose to come in every week. But then within that, I can make influence of saying, you know what if we switch this Coke out for something else or whatever else you're doing, right? To actually change better outcomes long term rather than seeing early onset diabetes and insulin resistance and all that. Whole separate topic. But the better sell would be of instead of 3 times a week or 2 times a week for 6 weeks, hey, you know what? You've got a new injury. Maybe I'll see you a couple of times in the next 2 or 3 weeks. And then we can taper off there. And then you train people to recognize when injuries are happening, when they should come in and when they shouldn't come in and go to the right place. I'll give you another example is a complete Achilles tendon rupture. This is a good one. So a patient of mine came in, this was 2 years ago, full Achilles tendon rupture. Pretty standard picture, weekend warrior, middle-aged male. Here's a snap, full rupture, and he goes the neurosurgeon route, doesn't get surgery, but gets put in a boot. But he's told to wear that boot for 32, 33 days before he takes it off. What do we know? Yeah, I know. This is what he was told. So his ankle is actually in a plantar flex position and it heals like that. When he took that boot off, he could barely even walk. He was scared to put his foot on the ground. That would be an example where, you know what, come in a little bit earlier and we can see you a little bit more often, get our rehab working quite well for you and give you better evidence-informed ideas that are going to support your better long-term healing. The next time he ruptured one, which was 2 years later, the first thing he did was like, hey, can I come in and see you tomorrow? I made time and we went through it, and the healing has been night and day difference. And you're absolutely right what you said before, Dr. Jess, is that his friends, his family, now I see a ton of soccer players and all these people associated with him that way. That makes me sleep better at night. That makes me realize I'm doing better results, getting better results for my patients, and meeting my evidence-based, everything I've been trying to write for the last 20 years here kind of thing.
I'd like to loop back to something you said a little bit earlier. I find it fascinating that you brought it up and also very important. And the question that you asked is, when does treatment begin? When they first start thinking about coming to treat. And that is such an important thing for everybody to remember. So could you dig into a little bit more about how you facilitate that process right from that moment all the way up to the point of discharge?
This will get out into a little bit more of the Chiro playbook, but it shouldn't just be a Chiro playbook. This is like interaction with anybody playbook. What I want people to do, and we get this comment all the time when people come into our clinic here, is when they step in the door, they can already feel that they're in a relaxed state. They're already going to be breathing easier. They're already dedicated to this process right here. So that process is something that facilitation of thinking of positive mindset and interactions with you at your clinic is what they think of when they're actually booking in. The other thing that they're recognizing too, and we were talking about this before, was they are recognizing you as an expert in your field. They trust the information that you're presenting, and it is your ethical responsibility in this shared decision-making process to make sure you're putting their needs and best interests first. How do you know when you care about somebody? You care because you want nothing but good things for them. Well, what am I trying to do here? I'm trying to create an environment of positivity and future wellness for you. So even when you come in, we'll go through, and we're going to talk about this in a future episode, I know, for even the orthopedic testing and assessments. If I'm doing something as simple as range of motion, and I have you lean to the side, I don't just do lumbar, I do full spinal range of motion to see how somebody moves. I will say your range of motion is great. That looks very good. Like, give them compliments for all the good things, and then when they get to the thing that doesn't work so well, they're like, oh, I can only get down here. We can say, all right, that's limited a little bit. So I gave you what did I give you? I gave you 8 things that were positive and 1 thing that was negative. So that they don't develop this mindset around their treatment of, oh, I'm broken, oh, this is a negative outcome, or this is a permanent change, or whatever it is. And it doesn't matter. If you're a kid, if you are 85 years old and you come in here, I think our oldest patient is 98 actually, it's always focusing on positivity and what are your ultimate goals and how can we help get you there together.
Yeah,
And that's
I
my
dig it big time. The workshop, and I was telling you about this earlier, the workshop I just taught in Florida at a conference was all about client compliance. And one of the things that I spoke about, in fact, the entire thing I spoke about, was essentially communication. Client compliance is about how you choose to communicate with your client, moving from the language of deprivation to the language of empowerment. And it is so bizarre how by shifting from I'm a person with chronic fatigue to I'm a person who really wants to go hiking again and I'm damn well going to do it. That's the thing that keeps them coming back and rebooking and following through with their home care.
Yeah, and like you were talking about this before too, prior to us starting this podcast, how do you prevent the burnout that a lot of people suffer in practice? Look at us both right now, how fired up and enthusiastic we are about this process right here, right? I am so much into this. Like I'll take people and they'll get them doing things they didn't think they could ever do. We'll do like acro yoga. I'll get them into jiu-jitsu. I'll take people who have never been into a gym and say, hey, let's go to the gym. I'll be there on Saturday. I'll walk you through some basic workout stuff. And how empowering that is for these little baby steps. It's all you need. If you really want to see what I really focus on, it's minimal effective dose. What is the least that I have to do to help you reach the results that you want? Do I have to get out ultrasound and take an x-ray of you and do all this kind of stuff? We know that stuff actually doesn't support most of the evidence-based best practices. We know that it's going to be a communication style, empowerment, and knowing when to load at the right time and gradually building up your tolerance at that pace.
When you're having these conversations with your clients, how do you go about rephrasing? Like I use a technique called motivational interviewing, which is essentially the right kind of questions to get them to come up with the ideas. They're the one who comes up with the treatment plan and all these type of things. What do you use?
Well, it sounds like you read exactly that. Our book's right there. If you look you have a copy of the massage therapy book. You also have a copy of the orthopedic assessment book as well.
Right there.
Motivational interviewing. I give you 2 pages on how to perform a motivational interview. Exactly that. And it has to happen with you spending the time at the very start, getting a detailed history and understanding what the person is really about. What do they do for work? What do they do for fun? Where do they really find their passions? Then finding that content and creating exercises and enjoy and laughter all about that. I'll give you another example. A patient came in with an ACL reconstructive surgery, very fearful of moving it. What we did, he was just sitting on the edge of the table right here, and we just swung our knees back and forth, and we said, wee, wee, and I said, pretend like you're a kid again if you want to. If I can get you to laugh and smile during the visit, I know that this has already been a winning process for you right here.
Mm-hmm. Yeah, it's shocking. And it's a super simple technique, right? It's not rocket science. You don't have to go back to school for it. I would suspect those 2 pages within those books, which I'm definitely going to take a look at once we're done our call, that's all you need. It's not a complex thing.
It is. And the thing is, you have to relate it to the age group you're working with, though, right? So if you're working with a geriatric person, they don't want to see some 20-year-old doing 50 push-ups because it's not going to be realistic or even relatable for them. But if you can show them another 85-year-old that's doing like 10 push-ups, that person can do that. I can see myself as that demographic, then I can connect with that, right? Like it has to be sports specific or activity specific, which I would suggest for a lot of doctors and therapists is you should get into as many different things as you can so you can relate to your clients a little bit. And you tend to attract those kind of people into your practice.
Mm-hmm. Yeah. And I mean, it's the classic SMART goal system that is overused in some cases, but for good reason, because it has to be relevant. Like you said at the beginning, we really need to understand their goal. And people's goal isn't to get rid of their shoulder pain. Yeah, they might say, I want to get rid of my shoulder pain, but that's not their goal. Their goal is to play with their grandkids, right? So we figure out the relevant goal to them.
Yeah, their goal is to raise their hand up for whatever they're doing. And I am not facilitating your goals by selling you more treatments than you need. And you know what? Even slowing my own reach and potential down too. Like as a practicing doctor, if I actually just see the same person again and again and again, I'm doing crack, 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 and it's not really changing any measurable outcomes for you, that time could be better spent with another patient where you can help somebody out. There's no shortage of sick people or people who can use your help for their health. But at the end of the day, too many docs get stuck, the chiropractic old school playbook of, I got to see you 3 times a week, and they just have this mindset that just does not follow evidence-based best practices.
Love it. Love it. I like that this episode is going to be short and sweet, our little half-hour chit-chats, and I'm looking forward to doing more of them and picking out really awesome topics just like this. So, of course, I'm going to put all the links to Dr. Nick's stuff in the show notes. And if people are watching the video, or if they're just listening to the audio, I'll put up the graphics of all the things that we've been talking about on this episode excellent. As well.
And remember, find practitioners that are designed, not designed, we're all designed. We all get our best joy out of teaching and helping other people, and just to create positive engagements is really what you're looking for. And that's why I love doing this kind of stuff with you, Dr. Jess. It's like, I mean, we're on the exact wavelength right here, connecting 100%. So super cool.
Awesome. Thank you kindly. We'll chat next time.
Okay. See you later, good sir.